Welcome to This Explainer. Today, we're unpacking a massive, almost completely invisible expense that's hiding right in plain sight. We're talking about correctional healthcare. We'll be using Tennessee's budget data to follow the taxpayer dollar straight through the justice system, and honestly, we're going to uncover how this incredibly complex hidden economy actually operates.
So where do healthcare dollars actually go behind bars? Well, understanding where our money flows inside the justice system isn't just some dry accounting exercise, it's a massive piece of public economics. Think about it. When someone enters custody, their medical, dental, and mental health needs don't just magically hit pause. So who pays for all of it, and how is the whole shebang managed?
To truly grasp the scale of what we're looking at, consider the figure of $1.4 billion. $1.4 billion. That is the Tennessee Department of Corrections' total operating budget for just one fiscal year, 2023 to 2024. That's a staggering slice of the state pie, and a very meaningful chunk of that goes straight to medical services. But getting the actual itemized receipt for that healthcare, yeah, that's where things get incredibly complicated.
Section 1. The Hidden Healthcare Economy. Tracing the taxpayer dollar through the system.
You know, if you look at a typical hospital budget, you'll usually find a neat, single total sitting right at the bottom of the spreadsheet. Well, not here. In the correctional system, healthcare spending is completely fragmented. It's like a giant puzzle. Those dollars explode outwards into this complex web of professional services, privately operated facility contracts, and local government payments. It's a deeply layered system, definitely not a simple line item.
Section 2. State prisons versus county jails. The fundamental split in the system.
To really understand this, we have to look at how the justice system essentially runs two totally different architectural models for healthcare. On one side, you have state facilities, run by the Department of Correction, operating under this massive, centralized managed care umbrella to keep their expenditures in check. But on the other side, county jails. These local facilities house a massive number of people on any given day, but they've got to shoulder the costs all on their own. They rely heavily on a total patchwork of fragmented local budgets, individual county contracts with medical vendors, and local hospital partnerships. It's literally a tale of two entirely different financial realities.
Think about the number $111.53. That was the reported average cost per day to house a state offender in Tennessee for the 2022 to 2023 fiscal year. Now, to be clear, that's the total cost of incarceration, not just medical. But inside that $111, healthcare is the absolute wild card. It's constantly pressuring that daily budget upward.
As our source material points out, healthcare costs are spread across multiple budget lines and providers. The exact receipt might be buried in the paperwork, and it's not always easy to isolate from broader correctional spending. But the sheer financial weight of it, it's undeniable across every single level of government. The cost is incredibly real, and it's baked right into the very foundation of how these facilities operate.
Section 3. The drivers of high costs. Why medical care in corrections is exceptionally expensive.
You see, people don't usually enter custody in peak physical condition. Quite the opposite, actually. They often come in with years of delayed medical care, untreated chronic conditions, and highly complex mental illnesses. Add severe substance use disorders and an increasingly aging inmate population into the mix, and you start to see the picture. These treatments aren't optional luxury extras, no way. They are core, everyday necessities required to keep the institution safe, functional, and operational.
Now, here is a fascinating reality. Facilities don't provide all this comprehensive care out of charity. They do it because of strict constitutional law. In fact, prisons are one of the only places in America where healthcare is a legally guaranteed right. When someone is incarcerated, the state assumes total legal responsibility for their well-being. Facilities literally cannot ignore symptoms or tell someone to just wait it out until they're released to get their chronic disease or psychiatric needs addressed. They are legally mandated to act.
And meeting that strict legal mandate requires doctors and nurses. But recruiting them to work behind bars, it's incredibly difficult. Because of intense labor shortages and high competition inside the walls, the state is routinely forced to send inmates to outside hospitals and rely on outside specialists. And when they do that, they're forced to pay a massive premium just to meet those constitutional requirements.
Section 4. Controlling the bottom line. Balancing legal obligations with budget discipline.
So, faced with all that, how do you actually control the bleeding? Well, states like Tennessee use a highly logical, strict three-step pathway that's all about prevention. Step 1 is rigorous intake screenings on day 1. You gotta catch chronic needs early, before they spiral into full-blown emergencies. Step 2 means treating patients in-house as much as safely possible because it is vastly cheaper than an expensive ambulance ride to an outside ER. And Step 3 is release planning. That means working to connect individuals to community care so their treatment isn't totally interrupted the second they step out the door.
Another absolutely massive weapon in their cost control arsenal is something called utilization management. Think of this as a strict financial gatekeeper. Before an inmate is sent to an expensive outside specialist, the state actively requires pre-approval. This ensures that every single taxpayer dollar spent outside the walls is clinically necessary. It aggressively strips away avoidable spending while still firmly meeting those constitutional legal obligations we talked about.
But here's the ultimate reality check for us: 95%. That is the percentage of Tennessee's incarcerated population that will eventually finish their sentences and return to society. 95%.
And that leaves us with a profound realization. Managing this hidden economy isn't just about balancing a state spreadsheet today. The reality is that the health conditions managed or ignored behind bars will eventually walk right back into our neighborhoods. How we fund and structure this care directly shapes tomorrow's public health. So balancing budget discipline inside directly impacts the broader future of our communities outside. It's a massive financial puzzle with very real human stakes. Thank you so much for joining me for this explainer. What hidden systems will you start questioning in your own community?